It's time for Fitness Friday. My guest today is Dr. Hemant Thacker, who is a Cardio-Metabolic Physician at Breach Candy Hospital. First of all, Doctor, thank you so much for taking the time. I appreciate the time that you're taking, and apologies for having kept you waiting. Also, a very, very happy Doctor's Day to you and all of the doctors at Breach Candy Hospital. I want to start by asking about heart health, because this is something that is emerging as a cause for concern for a lot of young Indians, Doctor. What have you seen of late that is giving rise to increasing cases of cardiac problems for the youth?
So definitely heart health is extremely important from the point of view of the fact that the heart is one organ that is responsible for sudden death. And this sudden death in young people is not so much because of decreased blood supply as it is because of electrical dysfunction, because of arrhythmia, fibrillation, etc. To give you a corollary, to run a good car, you don't only need petrol and oil, but you need good wiring and a proper battery. You need petrol and oil. If the voltage from your battery is inadequate or the wiring is inefficient, the car is not going to start. It's going to sputter and stop. By the same token, the young people of today who are succumbing or who are falling prey to cardiac ailments, one, definitely it could be because of blockages in the heart, which have heretofore silent and suddenly burst on the scene. And that could be because of poor lifestyle. The other, equally important, maybe more important, could be electrical problems, what we call as arrhythmias, where the rhythm of the heart, which is supposed to be regular and sustained, suddenly becomes very quick, what we call as fibrillation, or becomes irregular with premature beats. And as a result of which, the blood supply from the heart is not adequate to be supplied to the brain and other parts of the body. And that too results in a drop-dead situation. So cardiac function, which is a function of supply of blood and electrical contacts, is one of the major causes which we are seeing in young people for sudden death.
There are reports that suggest that COVID-19 or the recuperation after COVID-19 must be very carefully monitored, and very strenuous physical activity should be avoided. That could lead to complications. Is that something that people should be aware of, Doctor?
You have touched a very relevant point. The first thing when we tell our patients these days, last year we used to say 14 days, 2 years ago, last year we said 11 days, and today we say 7 days. And when we are nearing that magic figure where the Lakshman Rekha is over, the first question is, so when can I go back to my gymming? When can I go back to my physical activity? You know, today gymming, physical activity is something which is used as a support or as a guilt eraser for people with strange lifestyles who believe that whatever they do, they will be forgiven if they go on time to the gym and work their back out. Now, a cardiac patient or a COVID patient, both of whom have delicate hearts. Remember, COVID affects all the blood vessels, the platelets and the thrombotic tendency within the blood vessels, and you can also get COVID myocarditis. When you return or you're coming out and you're recuperating from COVID, you have to be very careful. Don't stress the heart. Anyway, you've been for 7 days quarantined. You've not exerted. Go back to work gradually. And work means only work, nothing else. 7 to 10 days, go back to work, and then begin a physical workout in a very graded fashion. Go 80% increase every week. 6 weeks' time, you are back to your normal. We as doctors do our duty by not only patients to this equation, also antithrombotic, only called as blood thinners or antiplatelet agents, so that the clotting, which is easy and which these patients are susceptible to post-COVID, doesn't happen and the patient remains protected. But certainly excessive physical activity, even if you're taking clopidogrel or aspirin or something like that, post-COVID can be bad because the cardiac muscle, the body itself, needs to recuperate slowly. And this is what long COVID is all about. It doesn't show, but every once in a while, with increasing regularity, we are saying that post-COVID, 6 weeks, 2 months, 3 months, we had somebody drop dead. So let's try and stray away from the unnecessary haste to make physical or regain physical activity into our regime post-COVID.
Fantastic. Doctor, a lot of people tend to stay away from these health checkups and tests of their hearts till, I guess it's too late. You need to check the plumbing, as they say. How often and how early should you start?
You know, we are in South Asia a genetically badly blessed population. Our genes make us thin, fat. We have large bellies, less height. We have a hypertriglyceridemia, which is a lipid fraction, and we have hyperglycemia, which is a sugar problem. So we are all metabolically a little skewed. So with this and a poor family history, I would like to start medical checkup at the age of 30. And if it is 30, I would say every 3 years till you're 36 or 38, and then every 2 years till you're 40, after which every year is a must. So what if you get a normal report? We have to convince people that you have come here to get a normal report, not to look for disease. Picking up disease is our issue. But the reason is, if you pick up diabetes early, if you pick up hypertriglyceridemia early, you can punctuate the problem and not have bad news early on in life or even in later life. Absolutely. We can train the patient, we can train the person to get his entire lifestyle altered according to his blood report. So you must begin at 30.
Doctor, thank you so much for taking the time, and thank you so much for your words of advice. Very, very important points that you've raised, specifically with COVID-19 and also the health of the heart. Wish you a very, very happy Friday and a happy Doctor's Day once again.
Wish all your viewers good health, because more than the wealth that ET is trying to preach correctly on the channel, I want to be a little 2 bits and say, health is still more important than wealth. Look after it, preserve it, if not earn it. Take care.
Absolutely. Thank you so much, Doctor.